My name's Katherine and I'm one of the consultant doctors at Homerton.
Can you tell me what BV is?
BV is the medical term that we give to some bacteria that sometimes live in the vagina. These bacteria are completely harmless, but the reason that we think about them and know about them is because sometimes they can cause a discharge, which some women notice either as an increase in the amount of discharge that they have or a change in the smell.
And what causes BV?
So these bacteria, as I say, there's no particular cause for them, and we know that because we know that if you take swabs from women throughout the menstrual cycle, then often these bacteria come and go without any particular triggers or certainly without any treatment needed to make them go away. But we do know that there are some things that make these bacteria more likely. They grow in an alkaline environment, so things which make the vagina alkaline make them more likely, and that would include blood, either around the time of your period or around the time of irregular bleeding if you're on a contraception making you have irregular bleeding. Semen is also alkaline, so they can happen after unprotected sex. They can happen if you wash inside the vagina and wash out the lactobacilli that are normally there. For some reason that we don't understand, bacterial vaginosis is also more common in smokers.
So how do you know if you've got BV?
So if you've noticed symptoms, then you may go to a sexual health clinic, and then what we can do is look under the microscope and look for these bacteria, or in some clinics they don't do that, but they test to see whether the discharge is alkaline. And then the clinic can tell you that you have bacterial vaginosis. But I think that we've caused enormous problems for many women by making this diagnosis, because we often follow up saying that you have bacterial vaginosis by offering you treatment for it, and treatment with antibiotic tablets called metronidazole. And it is true that the antibiotic tablets work to get rid of these bacteria, but the effect doesn't last for very long because the bacteria are quite likely to come back again. And the antibiotics aren't very nice to take. They can make you feel sick and give you a horrible taste in your mouth. There are treatments that you can use to get rid of it if you want to buy something from the chemist or online, and there are gels that you can put inside the vagina which either work because they're acidic and so they neutralise the alkaline environment, or they work because they are probiotics which contain lactobacilli, which are the other type of bacteria that usually live inside the vagina.
So do the vaginal gels work?
There isn't actually much evidence that they work, and they are quite expensive, but some women do find them helpful, and some women certainly like the idea of being in control of their own symptoms and not having to take antibiotics for BV.
So what can you do to prevent BV?
So you can try and prevent some of the things that trigger it. So for most women, getting rid of periods isn't an option, but you could try and prevent having semen inside the vagina, for example, by using condoms when you have sex, if you wanted to, if you thought it was worth it for you. And obviously, if you're a smoker, then you can stop smoking. You can also stop washing inside the vagina if that's something that you do at the moment.
So what would you say is the key message?
So the key message about BV is that it's harmless, it's not sexually transmitted, and that for many women it's a part of life that they have to come to accept is normal for many women. And then it's it's trying to find the balance for you between ignoring the symptoms and waiting for them to go away, and seeking treatment when it's really bothersome. And of course having tests for sexually transmitted infections if you've had a change in partner.